Hi, welcome to my channel Parenting Q&A. It's completely understandable to worry about stomach pain in pregnancy and be anxious about this being a sign of something more serious. But stomach pains or cramps are common in pregnancy and usually nothing to worry about. Some abdominal pain during pregnancy is to be expected. After all, your organs are constantly shifting, your uterus is expanding, and your ligaments are stretching, all of which can cause aches and pains. Mild stomach pain in early pregnancy, which is during the first 12 weeks, is usually caused by your womb expanding, ligaments stretching as your bump grows, hormones, constipation, or trapped wind. It may sometimes feel like a stitch or mild period pain. There is probably nothing to worry about if the pain is mild and goes away when you change position, have a rest, do a poo or pass wind. One of the main reasons for cramps is because of your growing uterus. As your uterus grows, it displaces your bowel, which can lead to nausea, a sense of feeling full easily, or a sense of inflation in your abdomen. The solution? Eat more frequent and smaller meals, exercise regularly, get enough rest, and empty your bladder often. Sometimes as the uterus enlarges, it stretches the round ligaments, which is the equivalent of two big ligaments that travel off the front of the uterus and down into the groin. Round ligament pain usually starts between 18 and 24 weeks, around when you start showing, and typically occurs on one side of your belly, though it can strike both. You may feel it as lower abdominal pain that radiates into the groin. It may be sharp and stabbing or dull and achy, and it usually lasts for just a few seconds at a time. It can be triggered by any movement that causes these ligaments to stretch, like coughing, sneezing, laughing, or getting up suddenly. Round ligament pain usually resolves on its own, but if you're extremely uncomfortable, ask your doctor if you can take acetaminophen, also known as paracetamol. Constipation and gas are often also part of the pregnancy package. Progesterone, a hormone that increases during pregnancy, slows down your entire gastrointestinal tract, making foods travel more slowly through it. To combat constipation, drink plenty of water and eat fiber-rich foods. If that doesn't relieve the problem, your midwife or doctor may recommend a stool softener or a fiber supplement. Avoiding gas-producing foods, such as sparkling beverages, spicy foods, fried foods, dairy products, and veggies like cabbage, onions, and beans, can help reduce gassiness. Stomach pain can be very worrying for pregnant women. Pain can make you fear the worst. It's important to listen to your own instincts. If you are worried about any pains you're having, or you just feel like something is wrong, contact your midwife. Don't be concerned about wasting anyone's time. It's always best to get things checked out. Most stomach pain and cramps in pregnancy are nothing to worry about. But there are some symptoms you should know about, as they could be a sign of something more serious. If you feel any of the following pains, even if you're not experiencing any of the other symptoms listed, call your midwife, doctor, or hospital immediately. Severe pain on one side of the lower stomach in early pregnancy. This pain could be a sign of an ectopic pregnancy. Other symptoms may include bleeding, pain in the tip of your shoulder, brown discharge. Feeling faint or dizzy, discomfort when pooing or weeing. Severe cramps in your stomach with or without bleeding that lasts for several hours. This could be a sign of a miscarriage or placental abruption. Placental abruption occurs when the placenta partly or completely separates from the inner wall of the uterus before delivery. Next is regular painful contractions or cramps before 37 weeks. This could be a sign of premature labor, especially if you also have the following symptoms. Either a slow trickle or a gush of clear or pinkish fluid from the vagina, or any increase in vaginal discharge. Backache that's unusual for you, cramps like strong period pains, a feeling of pressure in the lowest part of your stomach or pelvis. Severe pain in your stomach that doesn't go away. This pain could be a sign of placental abruption. Other symptoms may include tenderness when you press your stomach, back pain with or without bleeding. Pain in the upper stomach. Pain just under the ribs is common in later pregnancy because your baby is growing and the uterus is pushing up under the ribs. But if this pain is bad or persistent, particularly on the right side, it can be a sign of preeclampsia. Other symptoms may include a sudden increase in swelling in your face, hands, or feet, a very bad headache or a dull headache that won't go away, problems with your vision, such as blurring or flashing lights, vomiting, or just generally feeling unwell. Preeclampsia or high blood pressure in pregnancy usually develops in the second half of pregnancy. According to the Preeclampsia Foundation of America, preeclampsia and other hypertensive disorders occur in 5% to 8% of all pregnancies. Preeclampsia can develop after 20 weeks, which is one reason why your doctor checks your blood pressure at every appointment. This condition is characterized by high blood pressure and protein in the urine. Because high blood pressure constricts the vessels in the uterus that supply the fetus with oxygen and nutrients, the baby's growth may be slowed. Preeclampsia also increases the risk of placental abruption. Expecting parents with severe preeclampsia might also experience pain in the upper right portion of their abdomen, nausea, headaches, swelling, and visual disturbances like flashing lights. If you suspect preeclampsia, call your doctor immediately. Lower stomach pain or dull back pain. Call your midwife if you have this pain and one or more of the following. Pain or discomfort when weeing. A need to wee often, although on its own this is common in a normal pregnancy. A raised temperature, over 37.5 degrees Celsius, wee that smells bad, is cloudy or bloody, feeling sick and vomiting. These may be symptoms of urinary tract infection. It's not an emergency but should be treated as soon as possible. Other kinds of stomach pain include Braxton Hicks contractions. Braxton Hicks contractions, also known as false labor pains, are contractions of the uterus that typically are not felt until the second or third trimester of the pregnancy. Braxton Hicks contractions are a sign that the muscles of your womb are tightening. This can happen from as early as 16 weeks, but are more common in later pregnancy. Braxton Hicks contractions are irregular, more than 10 minutes apart, short-lasting, uncomfortable more than painful. You do not need to contact your maternity unit or midwife unless your contractions become painful and regular, which is less than 10 minutes apart. Contractions or cramps after 37 to 40 weeks could be a sign of the early stages of labor. This is called latent phase of labor. Wondering if there's anything you can do to help ease abdominal discomfort during pregnancy? Of course, the treatment depends on what's causing the pain, but these tips might be able to help. Change the way you move, especially if you're experiencing round ligament pain. For example, you might try sitting down and getting up more slowly and avoid turning sharply at the waist. Choose fiber-rich foods, including fruits, vegetables, and bran. Drink plenty of water, eat small, frequent meals, exercise regularly, in moderation and with your doctor's approval. Empty your bladder often. Prenatal massage, acupuncture, or yoga may also provide relief. Rest frequently, but remember, if have any concerns or you're experiencing any worrisome symptoms, contact your doctor or midwife right away. Here are some comments from forums on stomach pains in early pregnancy. I've just found out I'm pregnant, so only 5 weeks gone, but I'm getting what I can only describe as period pains in my lower stomach. I still feel like I'm gonna come on. This is my first pregnancy, planned and very much wanted, so worrying already. Is this pain normal? Has anyone else had anything similar early on? Any advice would be much appreciated, thanks. I too have just found out I'm pregnant and I feel exactly the same. A lot of women have said as long as it's not severe pain or with bleeding you probably have nothing to worry about. Me too, I have just found out I'm pregnant also and for the last 2 days had period-like cramps. I had the same with my first also. I went to the doctor and she said as long as the pain wasn't severe pain then try not to worry. I am 6 weeks pregnant and like you it's my first and very much wanting and longed for. I have had exactly the same symptoms. Feeling like I am about to come on, backache, lower stomach cramps. I'm now feeling really tired and sick. Totally energyless, hope it doesn't last too long. Quite a shock to feel like this as I have a very active life and job and at the moment haven't got the energy to do anything. Anyone else feeling like this or felt like this? How long did it last for, please? Don't tell me 9 months. Thank you both. I just don't know what to expect with it being my first, and I'm a bit of a worrier at the best of times. It is just like period cramps, so hopefully nothing to be too concerned about. You sound just like me. Every slight twinge or ache I'm thinking, is there something wrong? My partner tells me not to worry so much, but easier said than done. My body feels so different, and begin my first I have no experience of what is a normal. The fact that a lot of women including us have had period-like symptoms is nice to know, one less thing to worry about. Hi, I'm currently 31 weeks pregnant. The pains are everything about stretching and getting bigger for baby, and the tiredness does subside then comes back later. Good luck, ladies. This is also my first and planned for and wanted pregnancy. I had the same thing at 5 to 6 weeks. Crampy pains, and was really worried. Went to my doctor who said it's everything stretching. He felt my stomach and said that as long as your stomach is soft, which is not contracting, then all is fine. I had some bleeding a couple of days later, so was sent for an early scan and all was fine, and I saw the heartbeat, which was a lovely image. Anyway, just my long-winded way of saying don't worry. I'm sure you are fine. Hope you all have a happy and healthy 9 months. This is so reassuring as I too get the pains. Mine is worse in the night. I'm sure everything is normal, but it is hard when you've not experienced pregnancy before. I'm 7 weeks now and had cramps during 4 to 5 weeks and got extremely worried about. Everyone I spoke to about it said it was normal, but it's very difficult when it's your first as you have no idea what is normal. They have eased now though. I still get the odd twinge every now and then. The sickness has kicked in now. I had these pains until about 10 weeks. I was hysterical, something was going wrong. It's your ligaments stretching, making space for your uterus and little baby to grow. All the best with your pregnancies, and wishing you happy and healthy and stress-free 9 months. Thanks everyone, I feel so much better now. I guess I had an idealistic view of what pregnancy would be, and it's very different so far. I'm the same. Doctor reckons I'm about 5 weeks, but I estimate 4 weeks 2 days, and got really sore boobs, aches and lower tummy, and I need to eat a lot. My doc said you should only worry if you have severe pain across stomach accompanied with bleeding, but none of that. I don't feel sick, so possibly got that to look forward to. I have an appointment with the midwife, so just trying to take it easy and looking forward to that appointment. Hey, everyone, and congrats. I was exactly the same, felt really uncomfortable period cramps, real dull achy heavy pain from weeks 5 to 6 till about 10 weeks. It was nearly unbearable as I would normally feel this on first day of period and painkiller would get rid of it. I was quite worried too, and along with feeling nausea and extreme tiredness it was very hard at the time. But I am 16 weeks now and feeling great, and that is all forgotten about. Few little stretching pains, but nothing at all like early on, different pain altogether, and I'm not as tired, but do get little dizzy if I move too fast. But hope yours goes soon. Not everyone gets then. My friend is 10 weeks and she never felt anything. Best of luck. That's all for this video. Thanks for listening. If you don't want to miss future videos, you are welcome to subscribe to my channel Parenting Q&A and do turn on the subscription bell. Here I sincerely wish you all the best in your pregnancy, and I hope you're healthy and happy. See you in the next video.